Well, this is fantastic. I'm taking advantage of the slight quiet that developed spontaneously to get up here and introduce our afternoon. And uh, I just want to thank Dr. Stain for being here. I'm going to give more of an introduction in a moment. But we're also very privileged to have Dr. Tim Dellett, our interim dean and CEO, who has always been willing to be here for this event, for the Strauss Lecture. And this is the 74th annual Strauss Lecture. So really an incredible legacy and history of a surgical lecture, a medical lecture at the University of Washington School of Medicine. And so Dr. Dellett has agreed to provide some of the background of the Strauss lecture. Tim.
Good afternoon, everyone. Now, Doug and I are going to tag team this a little bit, I think, with slides behind me. Last year, if you recall, we got a little out of sync. So if the slides are not advancing, please let me know and we will stop. It is a real privilege and honor to be with you here this afternoon, really in recognition of Dr. Alfred Strauss, someone whose history began here at the University of Washington and had such a vital and significant role in the beginning of our own School of Medicine. And it's also a real privilege to have family members of Dr. Strauss with us here this afternoon, and I'll mention them a little bit more during my remarks. Now, in presenting the 74th annual Strauss Lecture, the Strauss-Friedlander family is carrying on the tradition established so many years ago by Dr. and Mrs. Alfred A. Strauss. Born in Germany in 1881, Dr. Strauss came to Colville, Washington at the age of 10. An honor graduate of the University of Washington in 1904 and an outstanding member of the Alumni Association, he received the singular honor of Alumnus Summa Laude Dignatus in 1951. Dr. Strauss was a football and baseball star as an undergrad. As an alumnus, he was active in the recruitment and establishment of scholarships for athletes at the University of Washington. In fact, he personally recruited more than 75 football players from Chicago to come here and play at the University of Washington, 5 of whom became All-Americans. In 1981, he was elected to the Husky Hall of Fame. Dr. Strauss received his medical degree at Rush University of Chicago Medical School in 1908, graduating first in his class. He interned for 2 years at Michael Reese Hospital in Chicago and completed a brief surgical fellowship under Professor Enderlin in Heidelberg, Germany. He then returned to Chicago, where he spent his entire medical career. Dr. Strauss possessed a rare combination of skill, vision, and drive, and was intimately involved with many of the firsts in the advancement of medicine, including refinement of pyloroplasty, subtotal gastrectomy for peptic ulcer disease, surgical advances in inflammatory bowel disease, and the first description of an abdominal wall zipper to facilitate frequent re-explorations. Now, Dr. Strauss and his 2 physician brothers, Herman and Siegfried, also University of Washington undergraduate alumni, founded Weiss Memorial Hospital in Chicago in 1953. Dr. Alfred Strauss is also well remembered for his influence on the founding of our University of Washington School of Medicine, which welcomed its first students in 1946. Back in 1944, Dr. Strauss, as a member of the proposed medical school committee, met with Governor Langley, strongly advocating for state funding for a new medical school. An appropriation bill was subsequently signed by the governor in 1945, and then that fall in 1946, we welcomed our first students at the University of Washington School of Medicine. True to his continued interest in this institution, Dr. Strauss sponsored a surgical lectureship in 1950 for the Department of Surgery, and these lectures have been a prestigious annual event ever since. Today's program is sponsored and supported by Alfred A. Strauss Endowed Lectureship in Surgery, established by the estate of Mrs. Marjorie Friedlander, the daughter of Dr. Strauss, and annually supported by generous contributions by Dr. Strauss's nephew, Dr. John Strauss, and grandson, Mr. John Friedlander, the son of Marjorie Friedlander. We are incredibly fortunate to have both of them with us here today in celebration of this annual lectureship. Again, it's my privilege and honor to, again, announce and provide this history for Dr. Strauss and this 74th annual lecture. Thank you again for joining us this afternoon.
Thank you, Dr. Dellett. That's a great introduction, and I just want to add my thanks to Dr. John Strauss and John Friedlander for being here. Your support to the Department of Surgery, to the University of Washington School of Medicine, and to this day, to this lectureship has been continuing for decades, and we really appreciate it, and really appreciate you being here. And I just want to note that we have a beautiful painting of Dr. Alfred Strauss just as you enter the entrance of the Department of Surgery chair office. So I get the privilege of introducing a friend and colleague, Dr. Steve Stain. We're really privileged to have Dr. Stain here, who is the chair of the Department of Surgery at Lahey Clinic and a professor in the Department of Surgery at Tufts. And you told me switching it to University of Massachusetts, I understand. So let me tell you a little bit about Dr. Stain. Dr. Stain started on the West Coast. As we heard earlier, he started west and progressively moved east, but Dr. Stain completed both his undergraduate and graduate medical education at UC Irvine. And he then did all of his residency, his general surgery residency at LA County and University of Southern California, and then did fellowships in surgical critical care at USC, hepatobiliary surgery at University of Bern in Switzerland, and health services research with the WAMC. So, someone like many of you or us who continued to train well beyond the requisite training of general surgery. Dr. Stain's first job was at USC. He stayed at USC and his clinical and research work was on diseases of the liver and pancreas. So he's been particularly interested in some of the research that our HPB team were providing yesterday and some of the things presented today. He was also the program director of the general surgery residency at Huntington Memorial Hospital in 1996 to 2000. In 2000, Dr. Stain was recruited to Lahey Medical College in Tennessee, and there he also was on the faculty of Vanderbilt and became a professor and chair of the Department of Surgery at Lahey and participated in the development of the Lahey Vanderbilt Alliance, where he then served as co-principal investigator of their $7.5 million NCI-funded cancer partnership. It was in 2005 that then Dr. Stain was recruited to Albany, where he spent a large portion of his career, 2005 to 2020, again as chair of surgery at Albany Medical College. So Dr. Stain has served as a chair now at 3 institutions for the last 23 years. While at Albany, Dr. Stain led to an enlargement, more than doubling of the size of the faculty at Albany, and an expansion of the residency programs in general surgery, orthopedic surgery, neurosurgery, vascular surgery, and plastic surgery, and initiation of fellowships in surgical critical care and colorectal surgery. It's most recently that Dr. Stain was recruited to be the chair of surgery at Lahey Clinic and be on the faculty at Tufts. He started there as chair of the Department of Surgery in January of 2021. Dr. Stain has been prolific as a surgeon scientist with multiple peer-reviewed publications, book chapters, a book, and work in oncology, hepatobiliary, health disparities, and surgical training. His current research efforts really have focused on healthcare disparities and surgical training. What's quite remarkable about Dr. Stain is a list of the leadership levels that he has held. I'm not going to tell you all of them because I want to leave time for Dr. Stain to give his own lecture. But just to highlight some of those, he has been the president of the Western Surgical Association, president of the Society of Black Academic Surgeons, chair of the surgical section of the National Medical Association, chair of the American Board of Surgery, chair of the ACGME RRC in surgery, serving on the Board of Governors for the American College of Surgeons, serving as chair of the Board of Governors for the American College of Surgeons, and currently one of the regents of the American College of Surgeons. And I think particularly notable is Dr. Stain's current position as president of the American Surgical Association. And for those of you that might be less familiar, that is the oldest and most exclusive academic or surgical organization in the United States. And so it's a singular honor to be elected by your peers to be president.